I didn't major in art. My brother is a professional graphic designer and does layouts for all the large companies like Hilton, Sheraton, Sofitel, all those things. My brother-in-law is the artist for Australia Zoo and does all of their setups. And if you've ever had your photo taken inside the big crocodile's mouth, he made that. He's got one of those at home in his front garden, which is pretty cool because the postman comes up and goes, "Oh my gosh, what is that?" So it's pretty scary. Bladder, prostate, penis. That's all you need to know. You can probably pass all of your male genitalia exams at med school with that. If you want to do a postgraduate course and really make it complicated, we'd have an anus in here with a bum behind here. So we've got bottom behind there if you want to go for honours at university. I better actually draw that on. Just give me a sec. Look at that. So someone said it doesn't look like a bottom. I don't look at them very much. If you come to me for a prostate exam, I actually won't look at your bottom, but you might see it on Facebook. The big thing to look for prostates. Now, I've done this talk for a few people, and people will have heard this here, but prostate cancer and large prostates are different things. Large prostates happen to all of us. The guys that are sitting down here that I can see, they're in their 20s. Most of you, your prostate weighs around 16 to 20 grams. So it's about a squash ball. That's what it feels like. It actually feels like a squash ball when you do the whoop. And it's got a little groove in the middle. So it's like a squash ball with a groove. The average 20-year-old can start and stop on command. They can usually hit the board from about here and write their name with a full stop. My son goes to uni, as I said. He goes to bed somewhere around about 10 o'clock, 12 o'clock after studying. If this morning he got to sleep in because he's not studying, he's still in bed, it's 10 o'clock. He won't have weed all night. But I've been up once or twice. Now, the guys that are here that are probably in their 80s would say, "I can't go to the urinal anymore. I have to go and sit down. Because if I stand at the urinal, I'm going to drip on my shoes." They've got to wait for the shake, because if they don't, behind your testicles and in front of your bum, that's where part of this tube goes. So when you sit down, if there's any wee left in that prostate because it's too big, you sit down and it squirts out. And then you get little rings around your pants. And you know how when they measure trees, how old they are? It's a very similar principle. So as I get older, my prostate will go from 6 foot to splash my boots. It will go to 80 grams by the time I'm 80. That's normal. But it shouldn't change suddenly. Things that change suddenly tell us something has changed in here. So, because there's only really our whizzer, our bladder, and our prostate. There's not a lot. There's a couple of other technical things in there, but basically that's it. So if my waterwork suddenly slows down from last year, there's something happening in my prostate, and I should be at the doctor's. Next thing, prostate cancer. Prostate cancer, if we have people that cark it for some other reason, and doctors like to cut people up to see what's happening. So if you die in the hospital, often the doctors will say, "Can we do an autopsy?" If we do an autopsy for some other reason, we find that at 50, 10% of people have prostate cancer within the package. By the time we're 80, it's 80%. By the time we're 100, it's 100%. Now, interestingly, the aggression of the cancer is the opposite to our age. So people with a prostate cancer at 80 probably have a life expectancy of 15 years sitting on my hands doing nothing. So I find a prostate cancer 80-year-old. I don't tell my patient, keep it secret. They're not going to die till they're 95, 100. So why do I tell them? Because I just freak them out. Let them go fishing, don't tell them. So once you get to 80 plus, it probably becomes irrelevant. Not because you're not worth it, but because the cancer is less aggressive. Prostate cancer is very unusual in young people, young being 50 less. It does happen. But from 50 to 60, 65, there's this high-risk group where the prostate cancer is getting lots of hormones, and it grows usually because of hormones which came from my testicle over there. So if I get a prostate cancer and my testicles are fired up because I'm still only 50, 55, it fires that up and it wants it to grow. And if my prostate grows, my cancer starts to grow quickly, that's obviously bad. So the guys that are in the bracket 50 through 65, you're the guys that I want to see at my surgery or at your GP and saying, what do I do? Some people have heard about a blood test called PSA. PSA is a protein that our prostate releases into our blood, and it's called prostatic-specific antigen. Normal prostates make it. So if I've got my normal 20-gram prostate, my PSA will be about 1. If I double the volume, I double the amount of PSA. Pretty simple. So if I'm 50, my prostate should be maybe 30 grams. I should have a PSA of maybe 2. If my PSA comes back at 12, I'm in deep doo-doo. Something's happening. Now, it could be a cancer, it could be a big prostate, it could be an infection. It could be that you sat on your bike and rode to work and the bike rubbed the prostate and released the prostate antigen into your blood. That actually does happen. So don't freak out if you go to your doctors and your PSA is up, because it might have been just that you did a big poo and it came out through here, or you rode your bike to the doctors. But PSA is a good screen. The problem with PSA, and this is the one warning about prostate screening, some prostate cancers become so aggressive that the cancer doesn't behave like prostate cells. It doesn't make PSA. So you go to the docs, he does your PSA and says, cool. The other problem is that particular group of tumours often occurs here at the front. This is the back where your bum is. So I stick my finger up your bottom and I go, can't feel anything because it's over there. That's about 5%. And those tumours often shoot off somewhere else and end up in our bones, because prostate cancer likes bones. So our wife gives us a big hug and goes, crack. We go to the doctors, he finds a cracked rib and finds out that we've got prostate cancer in all our bones. What I'm saying is a bit like your accountant. All due care and attention, but no responsibility. The doctor can't find everything. So sometimes there are a small number. One of my really good friends has a tumour like this, which just really couldn't be found. Someone was asking, can you do a wee test or something to try and find it? And the answer is no. So God keeps some secrets no matter how good our science is. But the take-home message is if your urine stream changes, go to the docs. If you're getting up around 50, get a PSA done. We know it's worthwhile. It does have limitations. Some doctors don't do it because of the limits. Others do everyone and rectal everyone. I start doing rectals 50, 55. If there's a family history, I might change that. If the person is particularly concerned, fine, we do it. It's not particularly nasty. Rectal exams are not fun, but they're not painful. They take less than 3 seconds. We go, whoop, 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 done. All right? And the worst bit is the doctor wipes your bum with some towel, which feels really embarrassing. So Watto is telling me to wind up. That's enough. We'll have a few questions.
Do you want to have a look at the results of the prostate cancer?
Outcomes?
You want me to pull my pants down and show you?
No.
Mark, we've got to pretty well wind up.
Yep.
He's got to go to surgery soon, and if we don't sort of let go with your last gem, we won't have any questions because we'll miss out the time for lunch and all that sort of stuff. He's good, isn't he? You know, he's a champion. And he only lives up the road, and every man can do something very well. He can come down to your shed night and tell you about what women really want to know, what we men need to do. So, whatever you, what did I say then? But anyway, if you just let go with a last little moment of whatever you like.
All right, so I've got 10 seconds to wind it up.
Yeah.
Beautiful. Thank you for having me. I hope that you have a sensational day. May God bless all of you and all your relationships. Next year, if you want me back, we'll do women's health. That's much more exciting. My artwork is sensational for that.
I want to ask you one question. You talked about God along the way, and you know him for real, and you're a doctor. When you do your little stuff on us, medical stuff, are there little moments where you really do know that we're created gems of the King?
Absolutely. Like GPs do science and we lose our science. It becomes more of an art. and my son, who is a scientist, gets very frustrated with medicine because they're separated a bit. But when you look at the science of looking at us, or looking at the world, the further we go out, the more we find. And the further we go down, my son actually is doing research with subatomic particles and trying to measure things that are below atomic size by freezing them and doing all sorts of stuff I don't understand. But we get down to there and we think we got it sussed, and God goes, ha ha, there's another layer. So we are truly wonderfully made. And like, if I do get a closing parting comment, I'd like to say, I just love my life. So I've made lots of cock-ups, and all you got to do is go to God and say, I'm sorry, I made a mistake. And if you're genuine about it, you're forgiven. And you can move on, and there's just another sensational day to live. So keep it rocking, boys.
Thanks, Mark. Jerry Gale.